Hello, my name is Stuart Redding, and I'm here working with the Physical Therapy Department at Baptist Health Medical Center in Little Rock, and I'll present to you the exercise program you'll be going through as part of your total joint replacement. I'll be going over each exercise you can do at home, and you'll be doing as part of your physical therapy after your surgery here at the hospital. I will now break down each exercise for you. I would like to start off by going over your hip precautions you will need to follow after your surgery. The first precaution is no bending at the hips beyond 90 degrees. To demonstrate, this is a 90-degree bend at the hips. You will not want to bring your leg any higher up or your torso any farther down, thus breaking your hip precautions. Important to remember, when sitting in a chair, you'll want to prop your surgical leg out when sitting down to maintain your hip precautions. Your second hip precaution is no crossing the legs. So important to remember, you don't want to cross over at the ankle or at the knee, thus maintaining your hip precautions. Your third hip precaution is no excessive internal rotation or external rotation of the surgical leg. Important to remember when laying in bed after surgery, if your leg has a tendency to roll outwards, to place a pillow on the outside of your foot or the outside of your knee to help keep your leg facing forward. A second thing to remember is when walking after surgery, to not leave your surgical leg planted in the ground when turning, causing you to excessively rotate your leg, thus breaking your hip precautions. The first exercise we're going to perform is called the ankle pumps. To do this, you simply need to move your foot back and forth at the ankle joint, as demonstrated right here. You'll want to do this 20 times. And the reason we do this is to improve circulation after surgery. There will be swelling in your lower extremities and to help prevent blood clots.
There will be swelling.
Yeah. The second exercise is called the quad set. To do this exercise, you'll want to tighten up the quad muscle on the front of your thigh. To do this, you want to push your knee down into the chair, thus straightening out your leg. You'll want to hold this for a 5 count and then relax. We will do this exercise 20 times. The next exercise that we will perform is the glute set. To do this, you'll simply just need to tighten your buttocks together, hold it for a 5 count, and then relax. You will want to do this 20 times. The reason we do this is for after you have a hip or knee surgery, the surgical side tends to be weaker, and we do this to help prevent you from having a limp. Next, we have an exercise called the short arc quad. To do this, we'll use a padded foam roll and place it underneath your knees. And then, what you'll want to do with the surgical leg is you'll want to kick your leg up, pause at the top, and then control it on the way back down. You'll want to do this slow and controlled and not too quickly to really work the quadricep muscle on the front of your thigh. And at home, if you don't have a foam roll, a good substitute is a rolled up towel or a large coffee can that you can place underneath your surgical leg. And there we go. You'll place it just underneath that knee and begin the exercises. Up next, we have an exercise called hip abduction. To do this, we will prop your surgical leg up onto a stool. We'll have you swing your leg out to the side and then back to the middle. We do this exercise to help strengthen the hip muscles. Also important to remember when doing this exercise that when you bring your leg back to the middle, to not cross the midline of your body to break your hip precautions. To do the hip abduction exercise at home, you can sit down on a couch or chair, prop your foot up onto the coffee table. You can place a small towel or washcloth underneath your heel to help you slide your leg out and back to the middle. Important things to remember is to not bring your leg across to the opposite side and to also keep your toe pointing upwards as to not excessively roll your foot out. By doing this, you will help maintain your hip precautions. Next, we have the heel slide exercise. To do this, we'll prop your foot up onto a rolling stool, and then we'll have you pull your foot back and then push back out. Important to remember not to pull your leg so far back as to get a greater bend in the hip than 90 degrees and break your hip precautions. You will want to do this exercise 20 times. Now I will show you how to do the heel slide exercise at home. You can prop your foot up on a coffee table like earlier with a washcloth or a small towel placed below your heel to help pull your leg back and push it back out. Remember when doing this exercise to not break your hip precautions and pull your leg too far back. Also remember to not pull your leg so far back to have your leg fall off the coffee table and hurt your hip. Next, we have the long arc quad exercise. To do this exercise, you'll start with your foot on the ground, and then you'll want to kick your foot up till your foot is level with your thigh. Pause at the top, and then lower your leg back down. We will do this exercise 20 times. The reason we do this exercise is to work the quad muscle on the front of your thigh. Now we will be going over your standing exercises. It is important to remember after your surgery, you'll be weight bearing as tolerated on your surgical leg. That means you can bear as much weight through your surgical leg as you can tolerate. Our first exercise is the heel raise. If you have a walker, you want to stand inside of your walker and then simply just raise up onto your toes, lifting your heels off the ground. And at home, if you don't have a walker, you can use the back of a sturdy chair, as so, to help stabilize yourself while performing this exercise. Our second standing exercise is called the mini squats. To do this one, again, you'll want to stand within your walker, and then you'll simply just want to squat down. It's important to remember that we do not want you going all the way down. We want you just going about a quarter of the way down. While doing this exercise, it's also important to remember to keep the back straight to protect the back. Also, to do this exercise at home, if you do not own a walker, you can use the back of a sturdy chair as demonstrated earlier. This exercise is called the standing hip flexion. To do this exercise, again, you'll want to stand within your walker. An important tip to remember is you can choose a point on your walker to focus on, and then you'll want to bring your surgical leg up forward towards that point. Remember to not break your hip precautions, bringing your leg above 90 degrees. Also, a tendency is to cross your leg over to the other side. By choosing a point on the front of your walker, you'll help avoid making this mistake and adhering to your hip precautions. Also, if you don't have a walker at home, as earlier, you can use the back of a sturdy chair to perform this exercise at home. This exercise is called standing hip abduction. To do this exercise, you'll want to slightly turn your walker away from your surgical leg to give yourself room. You'll then want to swing your surgical leg out to the side and then bring it back in. An important tip to remember while doing this exercise is to keep your toe pointing forward at all times as to not excessively rotate your legs and break your hip precautions. Also remember, when doing this at home, you can use the back of a sturdy chair if you do not own a walker. To help minimize swelling and reduce pain, we recommend that you ice your joint for 20 minutes after completing all the exercises. If you decide to ice more, remember to have at least 2 hours in between each icing.